Okay. Hopefully everybody can see and hear me okay. I'm gonna give it just a second to make sure that it's come up. Let me get on my phone. And welcome, anybody who is here, welcome to the final and fourth night of the weight loss webinar. So thanks for sticking with me throughout all of this. It looks like, oh, there it is. So yay, okay. So we're live. I'm about a minute early, so I'm just gonna repeat a few things that I've said the last couple of nights in case you haven't been able to join. Little information on myself. My name is Lindsay Venn. I'm a PA and a dietitian and a certified metabolic health practitioner. I work with two different companies, Venn Integrative Medicine, which is my own, and then Insulin IQ, which is a company I partner with. So great places, great resources in order to help you improve your metabolic health and to help you achieve things like weight loss if that's what your goal is. So if you missed it, the previous 3 nights I've done a webinar on the beginnings. It's kind of been a progressive style webinar. The first night was talking about the etiology or the history of weight and why we gain weight and what changed and why we had such an increase in overweight and obesity over the last several decades. The second night was really about what to do, how to apply weight loss strategies when it comes to your goals. Last night was about different tools and supplements and things that you could do to make the journey go a little bit better. And then tonight we're going to talk about the deeper dive issues. So things that may be impacting you or be a barrier to weight loss efforts that maybe you haven't looked at or considered. And so I want to educate you on those. So we'll go ahead and get going now that it's 6 o'clock. Let me pull up my slides and we will go from there. So let me share my screen. It's coming, just a second. Perfect, there it is. So, and I'm actually going to turn on my phone just so I can see any chats that are coming in on the website or on the Facebook page. So please feel free to send me questions during the presentation, though sometimes I don't see them all. And so if you want to make sure that I get your questions, make sure that you save them for the end because I can definitely scroll through them at the end. So anyway, so let's get on with it. So again, we're doing a deeper dive into barriers to weight loss, things that you may not have thought about before and may want to be thinking about now. And so again, I've done this every night. Disclaimer, this is not personalized medical advice. I'm not your doctor or your provider. So if you have things like this that you want to address, please visit with your doctor or schedule an appointment with me and we can do it legally that way. So just a little refresher, what did we talk about? So what is insulin resistance and why it matters? We covered in full what and when to eat, how to apply it to everyday life and special events, supplements and tools that could help, as well as tracking and other support options, including things like support groups and one-on-one coaching. So today I used again, and I always give full credit to Insulin IQ. This is their lovely, we call it the plagues of prosperity. These things are all the result of insulin resistance. And so these aren't necessarily causing more problems, but if you have any of these conditions, they're certainly a result of it. So working on your insulin resistance can be really important. But I do like to bring up, and that's why I put this here. And if you go find me on my website, you'll see this Venn diagram here because there's extra things that are involved in this that are not necessarily involved in what we teach over at Insulin IQ. So the plagues of prosperity, of course, address all of these items over here, and so we do cover that with insulin and lipid panels and fasting and different food options. But we also need to talk about different kinds of hormones that are involved, different, mindset issues, different kinds of support that you might get, gut health, inflammation, all of that. And so I do like to point out that there is stuff above and beyond just the diet and some lifestyle changes that can be adequately measured and addressed. So what is missing from the plagues of prosperity? So it doesn't really take into consideration your age. As many of you know, the older we get, the harder things become. And so that's something we're going to talk about. Men versus women. I hear it every day from my patients. My husband and I eat the same way and we are exercising the same amount. How come he's losing weight faster than I am? We're going to talk about why that is. What are your sex hormones, and are those potentially playing a role? Especially as we age, we know that they might be. Your thyroid hormone status. For most people, thyroid does play a role here, so we'll go deeper dive into that. Your gut health, the insulin IQ diet and lifestyle change does address gut health if you're doing it correctly, but do we need to go a little bit further into that picture? We certainly can. It may be playing a role. And then medication management is really important. Like we talked about last night, a lot of people are on medications that can be leading to weight gain. They're obesogenic, but also maybe you need additional medications because you're in a particular or unique situation where it would be appropriate to consider them. So let's talk the first one. And this presentation is probably shorter than the other one. So for anybody who's wondering if this is going to be as long as the last 2 nights, no, it will not be. So first, age. And like I said at the beginning, the older we get, the harder it is to lose fat, the harder it is to gain muscle, the harder it is to get proper nutrition, the harder it is to adjust our medications, and the harder it is to break these habits that we've had for decades. And so age does play a role. Obviously, we don't have any control over that, but it does play a role, and it's something to factor into the equation when you're wondering, why in the heck is this not working for me? Well, maybe if you're 70 years old, maybe that makes it a little bit more difficult, but it doesn't make it impossible. It's just something that we take into consideration on how we get it reversed and how long it might take to do that. So, and then the sex of someone. So why does it that men seem to have it easier? Men are very fortunate. Their testicles work throughout the end of their life. They don't stop making hormones like women do. Women stop making estrogen and things like that in over time when they enter menopause, so that's definitely a problem. Men tend to sleep better and handle their stress better. I say tend to because that's not always the case, but overall, in my experience, men tend to do a little bit better. They don't have quite so many boxes open like women do. We tend to have lots of boxes open that we're worried about all the time. Men typically are more active, so that can definitely play a role. Again, just typically, not always. And then men come into aging typically with more muscle. So if you think about it, when we know muscle is such an important factor in weight loss and metabolic health, if you're getting into this journey a little bit later on and you haven't been focused on muscle mass, especially for women, then you probably came in with a little bit less muscle than a man typically would. But the offset of this, which is really interesting, is men have more chronic health disease. And they really start to attribute that to the estrogen component. Estrogen is really beneficial for a lot of chronic health, and men don't make much of that. So they tend to have more chronic health disease because of that. But also, they tend to store more visceral fat, which will lead to more chronic health disease as well. So when you boil it all down, hormones really plays a big role in this, and we're going to deep dive. So first of all, which hormones am I talking about primarily? There's lots of different sex hormones out there, but the two primary ones I want to talk about tonight are testosterone and estrogen. They are important in both men and women, though we make them in different amounts. Men make a lot of testosterone and just a little bit of estrogen. Women make a lot of estrogen early on and very little testosterone. And again, as women age and hit peri and postmenopause, we are making very little of either of those. So why is this a problem? If these levels are suboptimal, and I really want to highlight that word because normal, like we talked about with labs and reference ranges, normal isn't necessarily a good level or an optimal level. So we want to make sure that your levels are optimized if we're going to do something about it. And insulin resistance, it plays a very vicious cycle kind of role. And so suboptimal hormones will lead to more insulin resistance. More insulin resistance will lead to more suboptimal hormones. And so we need to break that vicious cycle somewhere in that pattern. So again, there's many factors. Priority number one, fix the insulin resistance. This is easy to do with a lot of lifestyle stuff. So really work on fixing that insulin resistance. If the weight doesn't follow, then that's when we start chasing these sex hormone issues down a little bit more. Remember, the age matters. When we're looking at testosterone in men or estrogen in women, the older you are, probably the less you have. And then again, muscle matters. So for men's health, I'm going to start here, though I do tend to speak a little bit less to men's health than I do women's health, but that's again because of the menopause piece and the fact that we stop making hormones and men don't. But with men's health, we do know that insulin resistance will lead for a man to convert more testosterone to estrogen. This might be a good thing for that chronic disease concern, but it's not a good thing when it comes to how a man feels. So they're going to experience a lot of different things, including everything I listed here, which is erectile dysfunction, fatigue, brain fog, weakness, poor workout and recovery, poor libido or ability to perform, weight gain, or inability to lose weight with effort. Those are all good signs, common signs of low testosterone in men. Additional issues that can occur and I have several men that have come to me with osteoporosis, for example, that can be helped by optimizing these hormones, but also things like sarcopenia or muscle wasting and cognitive decline are greatly impacted by lack of testosterone. So if you wanted to check this out, and I will talk at the end about how you can do it through me, or if you want to get it through your doctor, or if you want to go to a self-pay lab option, these are the things that we would want you to get. So a free and total testosterone, a PSA, which is specific for prostate, a CBC, an estradiol, and something called sex hormone binding globulin. Be aware the reference ranges are huge on total testosterone. 250 to 950 is a ginormous reference range. I had a patient once explain it to me like this. They said, "Oh, so it's like feeling like an 80-year-old versus an 18-year-old." And yes, those different levels of testosterone really will impact how you feel a lot better. So for me, when I'm helping men with their testosterone, I try to get it in that 8 to 1200 for the total testosterone range. So what else can be done? So again, fix the insulin resistance first. That's the number one piece to do. Work on the diet, work on all the things that we discussed the past 2 nights. You can consider some supplements. So DIM is a good one. It is a broccoli and kale extract. It's a very benign supplement that can be helpful. It helps prevent that conversion of testosterone to estrogen. It also prevents the conversion from testosterone to DHT. And DHT is that end product of testosterone that tends to cause more problems, things such as male pattern baldness and whatnot. The other one to try or consider would be boron. It's just a very simple mineral that you can take. What it does is it lowers sex hormone binding globulin. If sex hormone binding globulin is high, then our testosterone is all bound up. We can't use it. And so if we can lower that globulin, we'll have more free testosterone, which would help improve symptoms because there's more testosterone that can be used. Other options that you need a doctor or a provider to help you with. So there are testosterone boosting medications out there. Clomid or clomiphene is a very common one that men will use, and there's different instances which you would want to use this over testosterone replacement. And there's instances where you would rather use the testosterone replacement. So again, you want to make sure to work with a well-versed provider if this is something that you really wanted to address. I do like to include this chart here because this was a study that was done, I don't remember the date, but they took a group of men who had low endogenous testosterone. That means that they're not making very much testosterone. And in those men, they saw problems with obesity, they saw problems with cholesterol. Their LDLs and total cholesterols were going up and their HDLs were going down. They saw issues with insulin resistance and type 2 diabetes as well. Blood pressure was higher in this group of men, and inflammation markers. This is a really big one too. All of these markers of inflammation that we can get were elevated in those with low testosterone. Then they took them and they put them on testosterone, so exogenous testosterone. And what did they see? They saw improvement in lean body mass, a decrease in body fat, a decrease in visceral fat, as evidenced by decreased waist circumference. Cholesterol markers improved, insulin sensitivity and blood sugars improved, blood pressure improved, and again, those inflammatory markers got better. And so there is a lot of benefit just health-wise above and beyond the symptom problems that men will experience with low T. Now let's talk about menopause. And I did put on here, menopause is a bitch, and I can vouch for that. I'm menopausal myself, and it is no fun to go through. And so menopause, what is the definition of menopause? I hate it when people use the words, I'm finally out of menopause, or I had menopause back when. Menopause, the definition is when you stop having periods, when a loss of menses. And so technically, when you stop having periods, you're in menopause for the rest of your life. It's not something that you actually ever get out of. Perimenopause, this other term, this typically starts in the mid 30s in women. Somewhere between 35 and 45 is extremely common. And that's when hormone fluctuations start. This is when your spouse, your friend, your whatever is going to seem like they're going a little bit crazy because their hormones are all over the place. One day the ovaries are working and making lots of estrogen, and the next day they're not, and they're making zero estrogen. And this leads to all kinds of problems. And so be aware perimenopause is an issue. And the sooner you start to address it, the better it will go. So how does this impact insulin resistance? Low estrogen levels will worsen insulin resistance. And again, it's cyclic like the testosterone is in men. Low estrogen worsens insulin resistance. Insulin resistance will worsen the estrogen symptoms that we get. So what do we look for? What happens? We're going to have an accumulation. Women, all women, even really healthy women, tend to get that little spare tire around their midsection when they start perimenopause or menopause. Other symptoms that can occur are listed here. So mood swings are a big one, weight gain, hot flashes, insomnia is a major problem. Vaginal dryness, low libido, sarcopenia, thinning hair, fragile skin, urinary incontinence, frequent UTIs, all of those things are symptoms and they just get worse over time if we don't do anything about it. And then, of course, there's the same additional concerns that are more health related. So osteoporosis, coronary artery disease, and dementia. Oops. So what do we need to do about it? Number one, do everything that you can to reverse the insulin resistance. Again, if you didn't watch the last two nights, go back and watch the last two nights. They're on my YouTube channel. Do everything you can to reverse this. It will make your weight loss journey and your menopause journey and all of that much better. Be aware that fasting might be a problem. So we see this all the time. And my answer to people is always this: if what you're doing is not working, then you need to do something different. And so if you're fasting through breakfast every day and you're struggling to lose weight, you're struggling with lowering your insulin levels, maybe you need to fast through dinner instead. Or maybe you need to fast through lunch, and have eating first thing in the morning and eating, at 5 or 6 at night. That might be a better strategy for you, but play around with it because every person is different. Some people do better fasting through breakfast and some people do worse. I've had some ladies who start gaining weight when they start fasting through breakfast. And so really play around with it. Make sure to prioritize your protein. I hope I've driven that point home. Same with the resistance training and the muscle matters. And then supplements are an option, and there's a lot of them out there. You want to get a good one if you want to do supplements, and I can provide a list. If you want the list of supplements, just message me. Um, the problem with the supplements is they can help with your symptoms. They might make your hot flashes a little less. They might help you sleep a little bit more, but they're not going to help so much with the osteoporosis, coronary artery disease, or dementia. And so ask yourself why. Why am I wanting to maybe consider fixing my hormones? And then base what your choice is based on that. So what else can be done besides supplements and fixing the insulin resistance and whatnot? Hormone replacement therapy is a wonderful option, but it is not for everyone. And so I do put that there because there's a lot of nuance to it. And again, this is a really good reason to work with a well-versed provider on this. So we have to know how far you are since your last period or since when you were in full-blown menopause. Ideally, we want to start in perimenopause with HRT or very shortly into menopause. We want to start with HRT. There is some guidelines out there, and I call it an arbitrary line because I don't know exactly why they picked this line. But if you're more than 10 years out from your last period, it's really a decision that needs to be very thoughtfully weighed out if you want to start HRT or not. Were you on other HRT? That'll play a role. So if someone, say, is 15 years out in menopause and they've been on, say, an estradiol pill, but they want to switch to something more comprehensive like what I offer, we can do that then. So you have to pay attention to whether you've been on HRT or not before. And then, of course, female cancer history plays a big role in this. We don't want to feed any potential cancers with estrogen, but we can still do testosterone in those patients and get a lot of the benefit, particularly with things like the osteoporosis, coronary artery disease, and dementia. So when it comes to what you can do or how you can take your HRT, there's several options. So there's pills out there, which I don't recommend because they increase your risk of blood clots. They're also a little bit harder on the liver because they have to go through first pass metabolism. There are nice transdermal routes though. So patches are a good one that you can get that are typically covered by insurance. Creams and troches, those ones are bioidentical and not typically covered by insurance, but they're wonderful because of the bioidentical factor to them. And then there's pellets, and pellets are just a small surgical procedure that you can have done. So you just want to find a well-versed provider who does those in your area. When we give HRT, we can give a combination of all four of these hormones. These are the ones that I recommend. Estradiol is the heavy hitter estrogen, and it's completely safe with risk of breast cancer and things like that. Estriol, this one is E2, this one is E3. Estriol is a lighter hitter. And so for a woman who comes to me who's been in menopause for 4 or 5 years, I'll start with an estriol heavy, if they're doing creams and troches anyway, an estriol heavy application and concoction in order to help them not have the negative symptoms of too much estrogen out of the blue. Progesterone is a must in any woman with a uterus that's taking estrogen. So we always like to incorporate progesterone. If you don't have a uterus, I still recommend it just because of hormone balance issues. That estrogen dominance thing we can prevent with taking progesterone. And then, of course, testosterone is wonderful for women. So what do you need to get if you want to go get labs, have your doctor run them, etc.? I always recommend the FSH and total testosterone. Those ones are essential to do a good job of dosing your stuff. Some people will want to get an estradiol and a progesterone. These can be somewhat helpful, but they're not overly helpful. So if you just want to get them on your own and get them the minimal amount, it's those two that are most important. So some major bullet points from this. If it's more than 10 years, be careful. If you're within that 10-year period, get started sooner rather than later. Other factors, consider your symptoms, consider your medical history, those kinds of things. For my women who don't have any symptoms of menopause, I don't hit them as hard with the hormones because we don't have to. I don't want to increase the risk of negative side effects by hitting them hard with HRT. So we take symptoms into consideration for sure. If someone is really sick, if they have polypharmacy and they're morbidly obese and they're sedentary and all those things, a lot of times HRT is not a good option at all. So that's where I'm talking about the general health. Supplements can be helpful. Bioidentical versus synthetic is a consideration everybody should take into consideration. It does need to be titrated to the person based on, again, on their health and their goals and their levels and how far they're out there into it. And it will help with metabolic health and longevity. And when I say longevity, I really mean health span. The longer we can be active and vibrant, the better. So there's the hormone spiel. So let's move on to the other hormones that are really important. So thyroid. Thyroid's a big one. And I can't enforce that enough when I say that. Thyroid is a major player with weight loss. If your thyroid is in the toilet, or if it's sluggish, or whatever word you want to use, you're really going to struggle with weight loss. It is the major metabolic driver in our system. It has everything to do with our metabolism, with our temperature regulation, with our bowel status, meaning if you're constipated or not, skin and hair, mood swings, all of those things, thyroid plays a major role. Typically, if you go to your doctor, they're only going to order these labs, the TSH with reflex to T4. This is so unfortunate because let me explain how it works. If your TSH is normal, then that's the only lab that gets ran. And the TSH reference range is pretty big in the scheme of things. It's usually 0.4 to 4.0. And so if you're at a 3.8 and it's normal and you don't know where your actual other hormones are at, you're missing the boat on this one because it is a big problem. So the other problem is that T3, our thyroid primarily makes two hormones, T3 and T4. There are others that it makes as well, but T3 is the major metabolic one. And if your doctor doesn't measure it or your provider doesn't measure it, you don't know where that's at. And so if your T4 is good and your TSH is good and you never measure T3, you really could be missing this piece of the puzzle when it comes to things like weight loss. So symptoms to pay attention to. Common symptoms of low thyroid: weight gain or inability to lose weight with effort, fatigue, constipation, dry skin, hair loss, depressed mood are very common. And some people, I'll rattle that list off to my patients and they're like, yep, I got them all. Or they might have one or two of them, but it is something to look into with lab analysis if you have some of these symptoms. The other piece to this is the stats out there show that around 30% of menopausal aged women do develop hypothyroidism. So if you're menopause aged and you're having some of these symptoms, there is a decent chance that your thyroid is pooped out. And so you definitely want to get these hormones checked. So what can you do? So number one, make sure you get the proper minimal lab analysis. And so when I want to do thyroid labs on patients, I get all four of these. TSH, free T3, free T4, and reverse T3. Some people like to measure total T3 and total T4. Those don't help us very much because we don't know how much of it is free and able to be used. And so the free versions are the most important. And then reverse T3, that is when your T3 hormone is inactivated. You can't use it. And so if you have a high reverse T3 level, even with a normal free T level, we want to make sure to address that. And we can do that with different supplements or medications. You can consider additional testing for Hashimoto's. This is the autoimmune hypothyroiditis. So the measurement, the labs for those are those two, typically TPO and thyroglobulin antibody. And remember, and I stress this one a lot. I've had a lot of patients come to me who are like, I don't want to be on any prescription, so I stopped taking my thyroid medication. And these people were doing very, very, very poorly. Thyroid hormone is essential for life. If your thyroid can't make hormone at all, or even only to a minimal extent, you're just going to lead to a shorter life. And so we want to make sure that your goal isn't to come off of your thyroid medication if you can't. Some people can, but if you can't, you need to just adopt the mentality of, you know what, this is essential for life. It's actually really good for me and my metabolism and a lot of other things. So don't step into this with the attitude of I want to come off of it because it's a prescription. Really look more at the attitude of how do I make this medication do a better job for me by improving my metabolic health and insulin resistance. Another thing I always like to talk to people about is this thing called subclinical hypothyroidism. And I would diagnose myself with this. When I checked my thyroid labs prior to starting a thyroid medication, I had very normal thyroid levels, but I had every symptom of hypothyroidism that there was. The weight gain, the fatigue, the constipation, the hair, I mean, you name it, I had them all. And that's what we would call subclinical hypothyroidism, where you have all the symptoms, even though your labs are normal. And I get this all the time from my patients too. My doctor says my thyroid is fine. He won't do anything about it. Well, maybe you need to look at the symptoms, look at the person more than you're looking at the piece of paper with the labs on it. So options for this range from anything. For Hashimoto's, it's really helpful to be on a gluten-free diet so you can improve your numbers by doing that. There's a lot of supplements out there that can be very helpful. And if not, then you can do this replacement, but I do highly recommend that you replace both T3 and T4. The common medications that your insurance wants to cover, things like Synthroid and levothyroxine, are only T4. And if you don't convert T4 to T3 very well, you're not going to do very well. And I didn't mention this, but I'll mention it now. T4 is the inactive form of thyroid hormone. We don't use T4 for anything. We convert it to T3 in the body, and then that's the metabolic driver that we've got. Some people convert it very well. Some people do not convert it well at all. And so if you're only taking a T4 medication, make sure you check your T3 levels, because if you're not converting, you definitely want to add T3. So where do we go from here? And it depends on where you are is always my piece of advice. You know, really step back and evaluate. How long did it take me to get here? Number one, if you're 60 years old and you've been metabolically sick for 40 years, really evaluate it. And remember that, you know, the things that you've done take time to undo. And so ask yourself, are you following the diet properly and consistently? Very, very important. If you're not, work on that. That is a lever you have full control over. Do you do any fasting? And if you do, and it's not working for you, like I've said, change it up. If you're not doing any fasting, maybe you should consider it. Maybe if you're doing some just intermittent fasting with like a 16/8, maybe consider throwing in some longer fasts. Those can be really helpful. Are you doing any resistance exercise? If you're not, add it in. You know, even just body weight resistance exercise can be very helpful. You can do it at home. You don't have to go to the gym, and it can make a big difference. Are you managing your stress? If not, work on that. Same with the sleep. And then are you on the proper supplements, which we reviewed in a lot of detail last night? So if the answer is yes, that you've done all of those things, everything that I have recommended, you're being consistent with, you're doing it properly, you've tried a variety of different ways of things like fasting, here's some other things that you might want to do. So number one, get the blood work done. I can't tell you how important it is to get a complete panel with all the things that I recommend so you can have a really clear picture of what's going on. Do you have specific symptoms that you don't like? You know, really sit back and evaluate where this is at. I just met with a lady who she was really struggling with it. We're putting her on HRT and she says, well, I did all this diet stuff and I feel so much better, but I feel like I could feel better. You know, really evaluate, do you have these? And even if they're minor, do you want them to be even better? Keep those in mind as you're visiting with your provider. And then really take into fact that if your doctor tells you things are normal, I don't want to say don't believe it, but understand that normal and optimal are two very different things. And in my practice, I compare it to a grading scale in school. Normal is a C student. Who wants to be a C student with their health? So we really want to strive to be an A student rather than a C or a D student. Oops, this doesn't want to move. There we go. So there are options out there. Number one, try to work with your doctor. That's always highly recommended. We want you to have a good relationship with your doctor. We want them to be part of your medical care. The problem is a lot of doctors don't want to do this kind of stuff, and it's because they're not used to it. They don't know what to do about a low T3 or a low testosterone or those different things, or an insulin. I can't get a lot of doctors to measure an insulin level, and the reason is because they don't know what to do with it if it comes back abnormal. And the reference range on insulin is so poor anyway. If it came back normal, they would completely miss your insulin resistance or prediabetes. So there are complete comprehensive panels that are available for very low cost. You don't have to go through your doctor. You can't go through your insurance for this, but they're very cheap now. There's so many people out there wanting to improve their health that a lot of labs have figured out how to do this. And so for me, I've partnered with two different labs that we can do this through. If you wanted to get labs through me, it's around $275. There are specific panels for men and specific panels for women that are at this cost. This is again a cash pay option. You can always use things like FSA or HSA. You can, if you want, you can just make an appointment with me. I'm always happy to take on new patients. You can learn from places like Insulin IQ. Insulin IQ has that wonderful 90-day course. They have a lot of coaches. They have myself. They've got different options if you want to go that route first, or you can do all of the above. I have created a program that will include the blood panel, consulting with me, access to the 90-day course, and it's all in a 3-month program that I would be more than happy to provide more information to, but I do want to do that more on a one-on-one basis. So how do you sign up? This is the big question. So this is my first time doing these webinars. I hope I get slammed, but I hope I can handle it all. But anyway, please email me. My email is lindsay@venintegrativemedicine.com. If you want to just do the lab panels, please put in the subject line weight loss webinar lab panel. And from there we will, and I'm sorry, in the email, you need to make sure you provide me with your full demographics. So this is your name, your date of birth, your phone number, your address. I'll have your email, and your choice of lab. So either LabCorp or Quest are the two places that we can go through. From there, you'll get instructions or a requisition, depending on which lab you pick. They'll get sent to you, and then you can go get your labs. And then what you do from there is completely up to you. You can, have a consultation with me and we can go over them in fine detail. You can sign up for the program that I talked about, or you could do nothing. You can evaluate them yourself, educate yourself, put them into ChatGPT like a lot of my patients do. They're all an option, but it's really important information to have. And I can't stress enough, if you don't have it, I really recommend to get it done. So anyway, that's the end of this one. Thank you all for participating this week. It's been an interesting, but joyful and beneficial journey. This was a lot of work to put this together, but I'm hoping that it will get out to a lot of people, and therefore we can help educate the world and help make people healthier. So I'm going to go ahead and get into on my phone, into the chat and see. So Marcio says, what about the androgen receptor expression? How do we make our tissues express more androgen receptors? That's a really good question, Marcio. Ideally what happens a lot of times with receptor problems is it's the toxins and stuff that we've been exposed to. And so doing things like, getting some mold testing, getting some stool testing, getting some heavy metals or environmental toxin testing done, and then doing different things to get those things improved. That would be the first place to start, because as you make those receptor sites more healthy and less burdened by toxins, that's probably the best way to do it. The other thing especially in men, for receptor expression, resistance training, of course, is very, very helpful. So let's see here. Amy says, thank you. Paula says, thank you. Thank you, guys. Marcio asks, why do men live less than women? And really, if there's a great book out there, if anybody wants to go do their own research on this, it's called Estrogen Matters. It's by a guy and a girl. The guy is a doctor. I think the woman was a patient of his. Anyway, but they talk about it's the estrogen, and this is where there's debate in my world right now on if men run a little bit high on their estrogen, is this a problem? So the way I counsel my men is if your estrogen's running high and you have symptoms of high estrogen, so things like erectile dysfunction, moodiness, gynecomastia, or change in breast tissue, then you do want to lower that estrogen. But in men who take testosterone and they convert that to estrogen and they're not symptomatic, it's probably a good thing. They have shown in a couple of studies that men with higher estrogen actually have less coronary artery disease and those kinds of things, and actually live a little bit longer than men who don't. So let's see here. Oops, anything? Oh, I think that's it. Very good. Kathy says, thank you. Very good. So awesome. Well, I hope this was helpful. I do plan on doing Tuesday. I actually set the date. No, Monday. Sorry. And I'll send out announcements, but Monday we're going to deep dive into labs. And so if you get this lab panel, for example, this deep dive into interpreting your labs on Monday will be helpful if you want to do that on your own. So that'll be on Monday. And then I'm going to be doing another one on Thursday. I haven't picked the topic yet, but I will this weekend and let everyone know. I do plan on my next multi-day webinar to be menopause. And so it is such a hot topic right now. And there's so many women who come to me just devastated by the fact that their doctor won't help them with their menopause. And so probably next month, my multi-day webinar will be menopause, but that might change too. We'll see what happens. So anyway, thank you everyone for joining. I really appreciate it. If you have any questions, concerns, you can always DM me. You have my email now. You can